Hello, this is Brian Chinook. I wanted to give information about a new study that we are starting in the emergency department. This is a study examining symptoms of dizziness by the patient and comparing it to the provider. The first stage of this study is to find proper patients for enrollment. The first step is going to be finding these patients with a complaint of dizziness. To do that, I would search the trackboard for symptoms such as dizziness would be the main one, vertigo might also show up there, imbalance. Dizziness and vertigo are going to be by far the most common descriptions that you'll find on there. But you might also look for things such as imbalance, lightheadedness, spinning, disequilibrium, or difficulty walking potentially. With any of those, if any of those complaints, but particularly the dizziness and vertigo, the next step would be to wait until the patient has been seen by a provider. After they've been seen up by a provider, and perhaps it's just the person who saw them up at triage, up at Pat 1. But as long as they've seen them, you can still approach them at that time and at least see if the patient meets the inclusion-exclusion criteria. Again, the inclusion is simple. It's just an adult patient with some sort of dizziness-related complaint. Again, so things such as dizziness, vertigo, disequilibrium, imbalance, spinning, lightheadedness. And then we want this to be a dizziness complaint that is somewhat new onset, so less than 2 weeks. Exclusion criteria, not English or Spanish speaking. I believe we just have the English forms right now, but we'll be working on the Spanish forms. If the patient is in custody, we can't do it then. Or if they have a physical or mental condition that does not allow them to be properly informed about the study purpose. For example, they're too drunk, too intoxicated, to an unstable psychiatric patient, then we cannot enroll them. I show this to the provider. Now this does not necessarily at this point have to be a provider that has signed up for the patient. Just as long as they were seen by someone up at Pat 1, then they can sign their name here, print their name, and then the patient is okay to approach at that point. Now, one of the things I'll show you the next forms you'll be approaching with, if the patient is eligible for the study, but does not want to participate in it, if you can fill out the form down here, we'd like to keep track of patients that meet the inclusion criteria and no exclusion criteria, but despite that are still refusing enrollment. Make sure to note that if possible, and try to get a reason from them if you can for why they're not. Because commonly it might be that they're too dizzy, they're feeling too bad, too nauseous, things like that to complete the study. So whatever it is, try to write down a reason for it there. So the next thing, when you have the patient to approach about this, is to discuss it with them. And for this is a study that does not require written, signed, informed consent. That is because for this study, we are not collecting any patient-specific information and not looking in their chart. We're not going to be writing down their name or medical record number or anything like that. But what we do need to do is give them a study participant information sheet, which is shown here. And this you can use to give them some general information about the study. Now, the truth is as you get used to it, you can sort of read through some of this to the patient, but really what you're going to do is leave this with the patient and give them the gist of what is being said here. So the gist of it is that this is a study in which we are approaching people with abdominal, chest pain, or dizziness-related complaints, and asking them about their symptoms and comparing it to the provider's reporting of their symptoms. About 175 people will take part in the study. If you agree to be part of the study, what we'll do is have you just fill out a survey that takes about 5 questions with a couple of extra questions in there, depending on your answers. The study, getting through the survey takes about 5 minutes. You can say no at any time, and it doesn't affect the your care here in the emergency department. Side effects or risks. There are minimal risks for participating in a study, but some might feel stress or worry of participating in a study like this. Potential loss of privacy. However, again, just to reaffirm that we do not collecting any sort of information like name or medical record number. No direct benefit to you to be in this study, but it does help us, helps physicians and health providers to better understand symptoms of, this does says patient dizziness symptoms, but we don't want to we're purposely trying to keep things vague for the purposes of not biasing the study. So we'll need to change this. So it's better understand patient symptoms regarding chest pain, abdominal pain, or dizziness. The choices, you can say no at any point and will not affect your care. We keep all this information private. We don't write down your name, number, anything like that. There's no cost for being part of the study. There's no payment received. By taking part in this study, you're not giving up any of your rights. You can leave this that you would as a normal patient. You'll have a copy of this, so if any questions come up later, you can contact the physician who is in charge of this study. And you can get, the idea is you get better at this. You can run through this more briefly, answer any questions they have. And next would be to administer the study to the patient. And again, this is sort of a general script here. And you'll talk to us, said the study is about certain symptoms we are examining in the emergency department. I will ask you questions regarding certain symptoms, and if you have them, we'll ask other particular questions about them. Have you had dizziness, vertigo, spinning, lightheadedness, or imbalance in the past 7 days? Yes or no? And then if yes, they need to be directed to say, well, which of those, what word would you say best describes what you're having? And kind of the idea is to get the word that they feel best describes it so that you can use that in future questions regarding this, whether it's, they call it dizziness or vertigo or spinning, things like that. Now, if the answer to that very first question is no, that they haven't had any spinning, lightheadedness, or balance the past 7 days, then we skip all the way back to question 4, whether they had abdominal pain or cramping, and then at the end they choose number 5. So again, very important that this is sort of a nuance that they've had it, that they've had this more recently. They're not telling us about something that happened more than a week ago. So the next question is and then sort of fill in the word for what dizziness symptom they're describing. Is your vertigo the main reason or part of the reason for your visit today? If yes, then classify whether it's the main reason or not the main reason, asking that. If it's no, you just keep moving to the next question. And then importantly, you ask, are you still having that feeling, that dizziness symptom now? Yes or no? If it's yes, you ask this question, has that dizziness been there all the time without stopping from when it started until right now, even if you were sitting without moving at all? If they answer no to that feeling, whether it's going on now, it says, do you notice particular movements, such as rolling over in bed, shaking your head, or movements of the head, like looking up at the sky or down at your feet, that bring on the dizziness symptom? Yes or no? Then we have sort of a different question that's related to asking about chest pain, pressure, or tightness past 7 days, yes or no? Is that the main reason or part of the visit today? And again, similar to the before of these dizziness questions, if yes, it's the main reason or not the main reason. And then move on to, are you still having that feeling right now? And if yes, ask them to describe it. Move on to the third question and ask if right now you're closing your eyes, not moving your head, and sitting still, is that dizziness symptom still present? And the next question is, do you feel like certain movements of the head or body can bring on the dizziness? Yes or no? Question 4, we move on to abdominal pain question that's framed like the previous chest pain question. Have you had it in the last 7 days? Is it the main reason or part of the reason? Or are you still having that feeling right now? And to free text, describe what that is. The final question, importantly, is they need to choose just one of these to best classify the dizziness symptom and sort of give them all, slowly make sure they understand them. But this whatever the dizziness symptom is it present continuously since onset? Does it come and go, can be brought on by certain head or body movements, or it comes and goes and is not brought on by any particular head or body movements, or none of these really describe my condition? But they have to choose one of them. They can't go back and forth. They can't ask, you can't, if they ask for a sort of general explanation, you can give just, if there's some word they're not quite understanding, but otherwise they need to sort of just choose one for this. After that, fills out that completes the patient part of it. At that point, you want to wait until you see that a provider has sort of fully picked up the patient, that they're signed up for it on the main board. So when you see that a provider has picked them up, you are going to then look for, wait to see that they've picked them up, maybe wait a little bit after that. And then the idea is that you want to ask the provider these questions only after they've sort of done their full history taking, which is why you don't want to do it just right after they've been at Pat 1, because they might not have got really a full history taking at that point. So all this here is something that the person can read. It's essentially just saying that this is a study, and you have any questions or comments about it, you can get this. But the main thing is, as you talk to the provider, get down what their level training is. The R1, R2, that means first year resident, second year resident, third year resident. Is it faculty, nurse practitioner, or a PA? Make sure and check that they've done their full history taking. If they haven't, just ask if you can go ahead and come back after, if you can come back and see them in a few minutes and try to get an idea when they're going to get the full history taking, and come back and see them after that. And then simple, just answering these 3 questions, which is, does the patient present to the ED with a dizziness related complaint? Dizziness, and all these ones, yes or no. If it's no, you can just stop. If it's yes, you move on and choose that sort of same final question that the patients were asked, to choose one of these descriptions to best classify the patient's dizziness. And then they have to choose one of these to choose their level of confidence in their classification of the patient's dizziness there. So how much confidence do you have in that, your answer to question number 2? All right. And that is it for it. And with any study like this, there's going to be questions that come up. I ask you to please make sure and text me or call me if you're right in the process of doing this. Janet will be in contact with you about what needs to be done in terms of when you're ready to perform this, do this survey on your own. And again, please contact me if there's any questions. Thank you.